Well, firstly, Alan, it might be helpful if I took a moment to probably explain the three options, because I think there's maybe a little bit of confusion about what it means for the region and what it means for patients across the region. So option A is obviously the continued development of UHL, which means the second 96-bed block plus a 66-bed development and 16 rapid build beds next year. And that's alongside the surgical hub that will open next year, and that's located about 3 kilometres from Dooradoyle. Option B, this is what the region put forward in the HIQA review, and it's a phased development of a new hospital. So essentially, as each phase opens to the benefit of patients, the next phase is already under construction. So that means beds and ancillary services such as labs, diagnostics, etc. So we envisage that would be to a 4 to 5 phase development of a new hospital, including the expansion of the National Ambulance Service right across the region. And option C is something that the Minister is looking at and is a one-off hospital. And I just want to go back to option B, because option B is not about waiting decades for a brand new hospital and waiting for one big opening. It's actually getting capacity on the ground faster, and it means that you're developing capacity on the Dooradoyle site and the supplementary site at the same time, but you're also getting access to the capacity in a phased basis.
And Sandra, do you know, has work begun, or is it to begin soon on identifying potential locations for that second site?
Yeah, so the Minister announced on Tuesday her intentions. She's given the CEO of the HSE the mandate to identify a site. So myself and the team are obviously looking at options to bring back to the HSE senior leadership team to acquire a site, and I expect to do that very, very quickly with the senior leadership team of the HSE.
Obviously, there's strong public and political interest in option C, the new Model 3 hospital with a second emergency department. When might a location be confirmed for that? Of course, as you're aware and from having spoken to us before, but I'm sure in other ways as well, that there's a real desire in Clare for the hospital to be located in this county. But do you know when we might expect to find out where it is going to be situated?
Well, the one thing I can confirm is obviously option A, which we're doing, and anyone that's passed by Dooradoyle recently will see that there's a couple of cranes around the place hanging over and construction ongoing on that site. Option B then is obviously I have the sanction from the Minister to go and identify a site. So that's where my focus is at, Alan, for what I have sanction for. And we will be getting on with that and bringing that to the region as quickly as we possibly can.
There are indications the delivery of a new hospital in the region could take 10 to 15 years. I know your focus is very much on A and B, but as I say, great interest in option C. Do you envisage it taking that long? Do you think it could be done sooner than that?
I understand totally why people are wary and hearing 15 years, and we can't afford to wait for 15 years for one single build. I agree with that, which is why we said that B is the optimal way to additional capacity very, very quickly. And what the members of the public will see, and what our service users and patients and our staff will see, is that every 3 to 5 years there will be new facilities, new beds available, new capacity available in the region. Whereas with the option C, I do believe that will take an extended period of time to deliver. And what I need to get on with now is what the Minister has given me sanction for, which is acquiring a site and making sure that we have a full site plan to develop additional capacity into the region as quickly as we possibly can. And that's what's really important to us, to manage the overcrowding, to get on with delivering the services that people expect to have available to them. So what I need to do is get the site, acquire the site, and get our planning in to start developing on that supplementary site as quickly as we possibly can. And I think the other piece is option B is also a hospital, but it's built on phases and you get incremental access to each phase. So if we're talking about 4 or 5 phases, you can kind of envisage a circle and you keep building around the circle in various phases. And ultimately, it ends up being a fully equipped hospital.
Which is obviously very welcome news as well. I suppose in terms of a time frame for the construction and opening of a new hospital, people will look at a nearby example, the new Bon Secours Hospital in Limerick, which opened in September 2.5 years after construction began. Is that a template? Is that the bar to measure the construction of a new hospital and how long it might possibly take and how to go about it?
I think it's more than welcome news, Alan, for all of the people reliant on services in the region. The Minister announced something seismic for the Mid West region on Tuesday, and it is absolutely to be so welcomed. You know, on Monday, we didn't have a pathway forward for the next decade in our region. We have that now. We have commitment from government. That's something that we have all wanted. We now have it. We need to get on and do it. In terms of the bonds is an elective hospital. An elective hospital can choose the patients that are admitted to their hospital. We do not choose the patients that we admit to our hospital. We have to have all supporting services at the back of a hospital to deal with all sorts of issues. Because as you know, when patients come into our emergency department, they could come in with any condition whatsoever.
And I appreciate that, Sandra, but I appreciate...
It's a really important point, though, in that if you're going to an elective hospital, you have pre-assessed that person for their suitability to be in an elective hospital. They do not have to have all these supporting structures around it in order to deal with unscheduled care. And that is a very key difference in terms of what's required for an elective hospital and what's required for a hospital that has undifferentiated take, and that means that you do not know the diagnosis when the patient is walking in the door, and that's a very, very key difference.
Okay, and I accept that there is that difference between the new Bon Secours facility and an elective hospital, but people will still look at that and say, despite the differences, there is a stark difference between 2.5 years and 10 to 15 years. But we were joined by the Mid West Hospital Campaign Group and Friends of Ennis Hospital yesterday on the show. Friends of Ennis Hospital positively optimistic about Minister Carroll MacNeill's recommendations. They want a firm commitment to any new hospital being built in Clare, and you know, it's something I've spoken with you and many others about. Those living in the more remote parts of the county, for example out west, would like to see that happen as well. Do you believe a firm commitment in terms of it being located in Clare is something that is a runner, particularly with people having concerns raised around 40% of our population living more than an hour from an ED?
Well, I mean, I've always been clear with your listeners and being very transparent in that I've always believed that we needed more capacity in the region. HIQA were very clear that the capacity, particularly for option B, needed to be in close proximity to the Doyle campus, and that's to facilitate us to move staff across both sites, both hospitals. Option C and a new hospital, that is a matter for the Minister, it's a matter for government. That's not a matter for me to decide on a location, and I think most people would appreciate it. It's not for me to make those decisions or necessarily have a view on. What I do have a view on is that we do need more capacity. We need to get that into the region as quickly as we possibly can, and I think most people will see the benefit of the 96 beds in terms of the level of overcrowding that the staff are dealing with, and they can see that is making the situation better.
The other thing the Health Minister has said in relation to the enhanced services at the other hospitals in the region, Ennis Hospital, St Joseph's in Limerick and Nina, St John's in Limerick and Nina, she says expanding health services in Ennis is going to benefit the entire region. Is that something you agree with?
I do, and I genuinely believe that the Model 2s have a huge role to play, and if we look at Ennis, you know, there's sanction for 48 additional beds in Ennis Hospital, there's sanction for new theatres, and obviously the satellite dialysis unit that's going to open next year as well. So we need to continue to get services out into Clare, out into Tipperary, but we also need to make sure that we have Model 4 acute care capacity in this region on top of all of that. And I think the Minister was really clear on that. But she's also committed to Sláinte care, and that is bringing care closer to people's homes. And this allows us to also do that in parallel with developing more Model 4 capacity in the region.
Just finally, Sandra, do you believe that implementing all three recommendations will solve the long-running overcrowding crisis, or will it go a long way towards that, but there will still work to be done even after all three options are pursued?
We have a pathway forward, and as I said, we didn't know this on Monday, and I genuinely believe that we have the best pathway forward. We have received a commitment from government for something most other regions have not received a commitment on. And I am really grateful to the Minister. I'm really grateful to the government. And I believe the government and, of course, the HSE are entirely committed to making sure that we do have the requisite capacity to meet the needs of patients in this region, which is what they deserve. There are almost 500,000 people dependent on us. We now have a pathway. We need to get on and implement it.